Hello, and welcome to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And every week I answer your questions about weight and weight medication. So if you're confused about your weight, if you have questions about weight medication, and if you want medically based answers to your weight questions, you are in the right place. Let's get started. As a caveat, as always, I can't answer personal medical questions. So if your question leans a little personal, I'm going to change it slightly so it's more broadly educationally applicable. Also, if you are somebody who is on a GLP-1 medication and it's going well, but you're like, now what do I do? Because there are so many other non-medical aspects of weight loss, I can definitely help you with that. I do work with people one-on-one as a coach to help them with the non-medical aspects of their weight. So people who are looking to exercise more consistently, people who want to change their schedule to prioritize their health, people who want consistent meal planning, all those types of things, I can help you with that. So I will leave all that info down below. So this first question is a little long, so I'm going to shorten it and depersonalize it. But essentially what this person is asking is they are thinking about starting Contrave, but they're really worried about the side effects and they live alone. So what should they do? Which is a great question because any medication has side effects, and we never know until we try what those side effects, how those side effects are going to present in a person. And sometimes people have no side effects. I have a lot of patients who are on weight medications and they have no side effects and they are doing just fine. And then I have some patients that get all the side effects. And then the majority of people are somewhere in between. But this person is going to start Contrave. They're worried. They've read a lot about side effects. They've heard a lot about side effects. I also have a video on lots of different side effects from medications. You can go check that out. But they're wondering, they're just a little timid about starting. And I will say that's very normal. I think it's a good sign in a way because, sometimes we have a very casual approach to these weight medications, especially recently, because we hear a lot about them on social media. We have a lot of friends and family that are on them. It just seems like taking an additional vitamin, and that's really not the case because these are serious medications. They're available only by prescription. So you do want to be appropriately careful. I will also add, every medication has a potential for side effects. So, some people take Tylenol and they don't do well on it. So there's always a risk that your body isn't going to react well to the medication. Thirdly, I will say that, Contrave, like all these other medications, is meant to start out at a very low dose so you let your body get used to it. So you should not be starting Contrave at the highest possible dose. You should be starting at a very low dose, see how it goes, and let your body get used to it. And then fourthly, I think if you're really concerned, if you're really worried about it, go back to your prescribing physician and have a chat with them. And I would just talk through your concerns. This is not personal medical advice on this channel, but certainly, everybody's medical history is different. So I would just talk through your concerns. And also it's important, I think, for everybody thinking about medication to realize that, yes, there are side effects with taking medication, but there's also side effects of not treating a condition. So you want to weigh the two of them because nobody has to take medication. That's not something that you're required to do. But if you're thinking about not taking medication, what are the side effects of that? So those are all questions that I would encourage you to think about and have a conversation with your physician, and best of luck. Next question. If you stop losing weight on Mounjaro and you're still in the overweight range with exercising, do you get more into the normal range? How does the medicine put you in maintenance if you're still overweight? That's a great question. And I think a lot of people, this idea of maintenance is very confusing. So basically what these medications do is if your BMI is starting out here and the medication works for you and you're tolerating it, it's probably going to bring you down to here. And eventually, your weight loss is going to plateau. Now, for somebody on Wegovy, the average plateau is at around 15% of the total body weight. For somebody on Zepbound, that plateau is going to be around 20% or more of their total body weight. So that's a good kind of standard to measure against, but they're only going to take you down to a certain level. And that's what I'm talking about when I'm saying maintenance, is that new normal that the medication brings you to. So you start up here, you get to here, you just keep taking the medication, and it's going to keep you there theoretically for the rest of your life. Now, if you want to bring your BMI lower than that, if that's something you and your physician have decided would be healthy for you, you're going to have to do something else. So what that something else is totally up to you, but these are kind of stepwise changes that we make. So you started out here. Zepbound or Wegovy brings you down here. If you want to go lower than that, you've got to add exercise. You can add a different medication. You can change how you're eating. Like, there's all different types of things. But when I say maintenance, what I mean is taking you from that initial BMI to the new normal, that new plateau that the medication is going to keep you on. And if you did nothing else, you would just stay there at that level forever. And that's why we tell people you really need to take these medications lifelong for now, with the knowledge that we have, because we do know when you stop taking it, in general, for people, the weight tends to creep back on. So it keeps you in maintenance by keeping you at that new plateau, that new normal. And then, yes, if you want to lose more weight, it's important to think about adding something else. This next comment is not so much of a question, but I thought it was so interesting and I wanted to bring it up and also see if anybody else has tried this. This is about tirzepatide and things you could add or, combine to it. You can also cycle tirzepatide, which many seem apprehensive to do, as they are afraid to go off. So basically what this person was saying is, I'm not sure if they had tried it or they knew somebody who had tried it, but this theory of, if you had gone up to, the top range, like 15 of Zepbound, and maybe you weren't having a great result, you could come off of it for a few weeks, start at the bottom again, and kind of work your way back up. So that's not something that I have done, but I think as we are learning more about these medications, we are thinking about different types of protocols and what will be helpful for people going forward. So I think there's a lot of room for experimentation, room for thinking about what's going to be most beneficial for patients. And certainly, in the same way we might do with a statin, a lot of times people can't really tolerate a statin well. You kind of play around with the doses. You might have them take it every few days to get their body used to it. There's lots of things you can try if you're not getting the expected result. And this seems like a sort of natural extension of that to things like Zepbound and Wegovy. So I think it's a very interesting idea. I don't believe there's any research on it yet. I think in the next 5 years we'll have we'll have new medications, of course, but we'll have a different idea about how we want to continue prescribing these medications. And this might be something that we use in our toolbox going forward. I'm not explicitly advocating it for anybody right now. I haven't done it myself. And again, this is not personal medical advice, but if you have tried it and it worked for you, I would love to hear about it, because I think it is a really interesting theory in terms of the next step in how we are prescribing these medications. So if you've tried it, I would love to hear about it. The common side effects posted in the video say may or may not resolve over time. What is this saying that you could possibly get a permanent condition of nausea or diarrhea from this drug? That's a great question. I am not sure if you're referring to one of my videos or one of the pharma company videos about the medication, but I will walk you through what I mean when I'm saying something like this. So basically, if I'm saying that a side effect may or may not resolve over time, for some people, like let's take nausea, for example. Let's say somebody starts Zepbound and they have a lot of nausea. For one person, that nausea might be present in the beginning, but as their body gets used to the medication, it just kind of fades away. And then by the time they're on their, 10 milligram dose, they just don't have nausea anymore. And it was just really in the beginning stages that it showed up, but then it went away. For somebody else, they might have persistent nausea despite, they're giving themselves a longer time to titrate up. Despite being on different doses, that nausea might not go away. So what I mean is the response is very heterogeneous. It's very different between patients. So some people, it's present in the beginning, it goes away. Some people, the side effects just don't go away. I'm not saying that the nausea will persist if somebody goes off the medication. What I have seen generally is when people stop the medication, those types of symptoms in general go away. So, and of course, everybody's different, and there are going to be the people who have the rare severe side effects. I'm not talking about that, but basically, everybody's different and their body responds differently. And I also have patients who, they know their body well enough on this medication that they can say, yeah, the first 24 to 48 hours, that's when I have my side effects, and then it goes away. So regardless of where somebody ends up with the side effects, that's where you want to make the decision in terms of, is this an appropriate side effect? Is this manageable? Do we need to treat this? Or is this, if this is persistent and really debilitating, then it might just not be the right medication for somebody. But everybody's different. And I've seen, especially with this class of medications, with the GLP-1 medications, that the different responses across patients, it varies quite a lot. So, and it varies quite a lot even in responses to different GLP-1 agonists. So somebody could have tried Saxenda, done really well on that, tried Wegovy, reacted very poorly, but they're fine on Zepbound. I've definitely seen that happen before too. So I hope that answers your question. That's going to do it for today. Thank you so much for watching. Thank you so much for sending your questions. I love hearing them. I love reading them. I love sharing them. I love answering them. So definitely feel free to leave a comment on this video or on another video. And I would love to answer your question. If you want to work with me directly, I will leave that info down below as well. Thank you so much for watching, and please be well.